All right, we're here with Ms. Marlene Hoag, the Deputy Administrator for the Health Department, and she has a little bit of laryngitis, so we're gonna kind of go easy on her. But just a few follow-up questions. First of all, there are, and we'll have this in the news banner, but there are a lot of people that could be part of the public health system. It's not just the health department and emergency management. There's private and public. Um, what are your steps or what are your thoughts about trying to now maybe contact some of these organizations that maybe not because you haven't alerted them or they don't know about, but they have not been involved with this assessment so far?
Moving forward, within the next month, we intend to get a group together, and we're going to look at that bubble chart, and we're going to choose those groups that have not been identified in the assessment, or they've been identified, they have not been at the table so
Right.
far. And that's maybe because we just didn't identify them early on when we
Right.
were choosing the people to come to the table, or maybe they're a contact, a problem with actually their calendars. But
Right.
in any case, we will be contacting them here, I'm guessing the next week or so, trying to get that group together and setting a date for this assessment.
Okay. Now, beyond this one-day training that might happen within the next 3 weeks, any formal steps now to take all of this and turn it into something tangible?
Yes.
And
I mean, I think that's why we were
right,
here
and-
today and why we're starting to move forward. We all recognize the need for there to be a public health committee.
Right.
As I said earlier during the assessment process, it seems as though the risks are higher in public health now today than they've ever been before.
Now, could you
And-
clarify that quickly, please?
Well, I think, we move around more. We're more global than we've ever been before. So disease comes back here to us. We ride airplanes every day. It's
Right.
not something that we do once every 4 or 5 years and do a major trip, like they used to. And even this morning in a board meeting, it was stated that every generation has their own panic mode.
Right.
But it just seems like, and maybe it's just because we're in public health now, I actually feel like that we are more at risk now because there are just so many more diseases that we've learned about and that they're more communicable. And also because we've got more education about those.
Right.
So
Do you foresee this committee, and as steps grow and whatnot, and as collaboration just improves, also tackling non-disease specific issues such as smoking and obesity tend to be the popular ones, but it could be anything like that.
certainly, because all of those things are public health. So whatever the issue is with the health of the public, we definitely have to address. So yes, obesity and smoking has definitely been a focus from some of these groups in the past.
Right.
And we're not going to let that slide by.
Right.
Those are two major conflicts of health right
Right.
now, so.
Now, how could a committee perhaps address issues that people have been trying to address for years, and sometimes they just don't seem to go away? I mean, how can we value add as a way to do that, to maybe find a new way to help penetrate this a little bit?
Education.
Okay.
Education, and we have to start early. Our kids, generations of today are born with computers in their hands, but we just have to focus more on education and getting the word out there, communication.
And you think a committee could do that more efficiently, or for lack of a better word, better than perhaps what is currently available or able to?
I think so, because we're agencies working together.
Okay. And now, there were several specific steps to discuss what we can do next, form a community health profile, different things to start to the road to that committee. Why do you think, perhaps it's too early to say we're definitely going to do this next, but do you have any thoughts of what you'd like to do next or where it could go?
I think we need to identify that health assessment committee. I think the public health committee is going to be the first thing that we need to do, and get a commitment from them. Everybody at these tables, in those 3 days, all 20 of those people that sat there
Right.
were very committed to that one goal.
Right.
And it's betterment of health in Wells County.
Right. Do you foresee this in any way expanding the jurisdiction and executive power of the health department long term, or is it too preliminary to tell? Or can you guys even have control over your own executive power?
I think we're 1 to 25%. How does that go? No, I think that You know, there's a lot of issues that comes into public health, and I've
Yeah.
always been one to say that public health really shouldn't be in the political arena, because funding and all of those things. But
Right.
I will also put a plug in for the health department that
Mm-hmm.
we do very good in maintaining the issues that
Right.
are present,
Right.
and we try to be involved with all of these other agencies.
Mm-hmm.
So I would hope that the executive decisions are community-based,
Right.
and that the health department is able to move forward.
Okay.
So.
All right. Not necessarily for the camera, but I'm curious, even kind of separating this right now from the whole committee and issues, whatnot. Does a county health department, even separating Wells County for a second, have the authority to say we're going to start enforcing this or legislating, for lack of a better word, this, or does it kind of come from the State Department and you have to act upon what they do?
Our laws, there's Indiana code
Mm-hmm.
that kind of sends it down to the local health department, and we
Okay.
have to have either ordinances or policies and procedures to address that.
Okay.
So it's kind of governed by a higher hierarchy than us starting something here. We can do things like assessments and, promote different health issues and
Right.
et cetera. But as far as, we're not instrumental in doing the laws, changing them possibly, but,
Right.